Ben, remind me, are we live streaming on Facebook or on YouTube, or where do we live stream to?
YouTube.
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 Yeah.
Okay, folks, well, welcome to the January 28th, 2021 session of the Board of Library Trustees of the Allen County Public Library. Let us take a roll call. I thought I saw Denise.
Yes.
Oh, can we take a roll call, or do you want me to take it?
Well, the secretary generally does that, so that would be Gloria. Is Gloria on?
Gloria?
She's muted.
She was here.
She's muted.
Gloria's on.
Oh,
There is.
Gloria, take a roll call.
Yes. Jim,
Present.
Marty,
Present.
okay. Ben,
Present.
Sharon,
Present.
and I'm here, and I'm forgetting
Kent.
Paul.
Kent and
Yep, present.
Paul.
Paul.
Paul. Thank you.
I'm here.
Thank you.
Okay. 7 present and none absent. I'll entertain a motion that we adopt the agenda as mailed.
So moved.
Second.
Any discussion? All in favor signify by A. Aye.
Hey.
Hey. That's my Connecticut background. Eh? Connecticut Yankee here. And opposed by nay. Okay, there. So now let's move to the session where we are meeting as a Board of Finance, and our treasurer will give us an investment report. And David, it's yours.
All right, thank you, Ben. In your packet should be a separate group of reports for the investments. Again, another example of pandemic hitting our operations. You can see from that with the Fed's response to the economy dropping and their cutting of the interest rates, it had an effect on our interest earnings. As you can see, earnings went down around 67% this last year. Yields went down 70%. I guess we do as best as we can. We're still increasing. We're at 90. We try to keep above 95% invested. Right now, the investments are still primarily in money market accounts because long-term rates just are not coming up. As you can see, the very last page of that packet, I put our CD rates, and we look at CDs as very often, but you can see in order to get a similar rate to what we're getting on the money market, we'd have to go out anywhere from 15, 18, 24 months, and there's no sense in tying up those funds like that and not having liquidity. So we're keeping them primarily with Lake City. They are paying 410 or 440 basis points, and Star, of course, is our operating accounts. Those are paying at 20 basis points, or 39, I should say, in Lake City. We continue to monitor things. I know because of Indiana, we're very limited on what government funds can be invested in. As the report lists there, they have to be the most secure investments, and that's good, but it doesn't lend itself to a lot of interest earnings. So not a whole lot else I can say on that. Hopefully, as the economy goes up, but I know the Fed just said they weren't going to raise interest rates again, so we're probably going to be in this mode for a little bit. But that's the quick report of it. I'd be glad to answer any questions you might have.
Any questions of David?
Yeah, I have a quick question.
Sure.
At the end of 2020, what was our reserves?
Reserves, well, we had, if we go into the financial reports later, but you'll see we're close to 40 million in cash, of which I would say our reserves free for things like capital would be over 18 million.
Okay.
Yeah.
Thank you.
Yeah, that's holding back usually around 12 to 13 million for cash flow.
Any other questions? If not, David, thank you for the investment
Thank
report.
you. Thank you.
Are there any other items of business under the rubric of the Finance Committee, Board of Finance? If not, I'll entertain a motion that we adjourn the Board of Finance meeting of the Board of Library Trustees.
So moved.
Jim first,
Second.
Kent a second. Any discussion? All in favor, aye.
Aye.
Opposed, nay. Okay, the meeting of the Board of Finance is adjourned. Let's go to then the next agenda, and that is the regular board meeting of the Library Board of Trustees for January 28th, 2021. Let the roll call show that all board members are present, and I'll entertain a motion that we adopt the agenda.
So moved.
Motion,
Second, this is Marty.
Jim and Marty. Any discussion? All in favor, aye.
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 Opposed, nay. It passes unanimously. We're on a roll. Okay, in your packet, you received the minutes of the regular session of December 17th, 2020, minutes of the executive session of the 21st of December, 2020, minutes of the executive session, December 22nd of 2020, and minutes of a special session, January 7th of 2021. I entertain a motion that we approve the minutes as forestated.
So moved.
Kent, and the second. Second, folks, help me out.
Sharon, I'll second.
Sharon, okay, good. Is there any discussion of any of the minutes? If not, seeing and hearing none, all those in favor signify by aye.
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 Opposed by nay. Okay, this still passes unanimously. Terrific. All right, let's go into the financial. David, you're up again. The financial.
I am. Thank you. And in your packet, of course, are the financial reports. And these are, of course, pre-audit. We still have a number of adjustments that will be made as we go through the audit season. But all the lines are doing well. There's a few that jumped out, but nothing that the whole segment is not in the positive. As I note in there, there's no need for any further transfers or anything like that. The budget appropriations are in good shape. Some of the highlights from the financials, again, because of our shutdown and the reduced spending that I've been talking about all year, we ended up increasing the fund balance by about 4.6 million this year. And this kind of goes back to the discussion in the finance Board of Finance report that Paul had asked, because of the reduced spending, plus revenues came in much better this year, kind of leaking into the discussion of what could happen in 2021. Amazingly, property tax collections came in very high. In fact, our loss, total loss, uncollected, shall we say, was around, let's see, 1.8 million. It was anticipated by the state tax, group that it would be around 2.9 million. So what our normal loss on tax caps would be around 9%, it's looking at about 7.2. Now we don't have a breakout of how much was tax cap and how much was uncollected, but the number that we had been watching all year in 2020 was how many tax dollars might be lost in property tax collections because people could not afford to pay them or whatever. That's never materialized. So that came in very well for us. And then, of course, the increase in COIT, in the COIT revenue came in almost a little over $1 million higher. And that was a special distribution that had occurred of 450,000, but also higher than what the initial budget way back in would have been August of 2019 indicated. So the combined, not to blabber on, but the combined revenue increase and the expense, decrease has combined to, increase our fund balance. And that's what's going to push that reserve over 18 million at this point between the LRF, the rainy day fund, and the general fund. So, looking ahead to, I know, part of the report later is the capital plan, the facility master plan. We're in a very good position to have reserves pay for quite a bit of those repairs, though not repairs, but construction, whatever it might be suggested by them. So financially, in pretty good shape that way. Obviously, the hot topics on the wire these days are, okay, what's going to happen in 2022? And we've been talking about that for a while. There's a number of groups, whether it be the Department of Local Government Finance, State Board of Accounts, and some of the groups like Larry DeBoer's group out of Purdue Extension that look at these revenue things. And there's a number of seminars and webinars coming up that are going to start talking about the impacts of the COVID-19 pandemic on the revenue collections. So as those happen, I'll keep you posted. We're still anticipating quite a bit of impact. And there's some actually legislative items going through the current session. We're keeping an eye on that could impact not only the how property tax growth is calculated. Just when they had gotten the maximum levy growth quotient figured out, there's legislation to change that, as well as the income tax distribution, how that would be distributed. So I remember, I think, Paul, you had mentioned earlier this summer, there could be things happening, and you're right. We'll have to see what happens in this legislative session that might change some of that. So, but we're watching it and keep it, I'll keep you posted as those things develop.
Thank you. Any questions of David?
Yeah, I've got a couple, Dave.
Sure.
Looking at the overall finance report, there were a couple lines that were a bit higher this year than last year. And I think I know a little bit of it, but I thought if you could explain it. On the compensation and benefits side of it, we were about $1.3 million higher than last year, if I'm reading things properly. I'm assuming that our pay classification impacted that, as well as our annual increase. And
Absolutely.
I just wanted to ask, is that the totality of that increase, or were there additional things on that?
No, I mean, a big portion of it obviously was the Pontifex study that went into effect, as well as we had put the 3% across the board through. So that was in there. Really, nothing stands out. There were a number of retirements also. Individually, not a big impact, but together, as people retire, they're going to get vacation accrual payoff, things like that will add to it. So the combination of all those factors is what put that up.
Yeah, that makes sense on that end of it, because I knew that, we had said there were, as we announced in the December board meeting, there were a lot more retirements than usual. So that makes sense to me. Okay, thanks.
Just the 3% alone would be, somewhere in the vicinity of 450,000.
Yeah, and I was thinking we were probably right around there as well for the pay classification, the Pontifex increase as well. So, okay. Yep. The second item was the insurance line, went from 2.6 to 3 million. So I wasn't sure, from a $400,000 increase, how's that explained?
Right. Well, the insurance that you're talking about, the 2.6 million to the 3 million.
Correct.
Yeah. This year was still very good. The big ticket item in there you can see is the self-insurance fund. That accounted for 2.6 million of that. As those continue, to do well, we haven't had any large claims, and that it's still, staying down. Our insurance itself, like property, casualty, things like that, part of the reason that got driven up was we went and shifted the renewal dates on our insurance policies into a March renewal date. So what would have normally been expensed in 2019 for renewals in December moved into 20. So the premiums that we pay for some of those policies were now moved into 20. So it made 20 look a little lower. 19 was less. So that's part of it. Yeah.
What was the reason for that?
Just the way they were trying to get information that, required end of year numbers when they were looking at the liability, the director's D&O insurance, things like that. And you're trying to do a December renewal, you haven't got a full year's of information. So a lot of the liability insurance, we moved to that March renewal so that we would have a full year of information for them.
Gotcha. Just kind of tagging along with Kent's question, I guess. A couple of months ago when we finalized some of these items, particularly with regards to the self-funded component, there was an opportunity, albeit the timing was not appropriate to do that, which certainly I understand. But what's your timeline for implementing that? Not this year necessarily, but being prepared. I know the big issue is educating the employees, et cetera. So what kind of are you thinking?
And we're still planning on having that. My feeling, and Kendra, you can correct me if I'm wrong on this, but that's still going to happen this year so that we can have it available for the open enrollment for 2022, which would mean we'd have to have this done by, let's say, July of this year. And again, Kendra, let me know if I'm, because it really falls a lot on you, but it would happen no later than the summer, because in order to put things in the budget, I need it by August.
Right.
Yeah.
Well, there are a lot of employers out there that are looking at that scenario. So
Sure.
We'll make sure it's still somewhat top of mind as we go forward.
Right. And I know Frank is continuing to work on, getting those numbers and everything, and has done some scenarios. We have a end of year recap meeting, I think, planned for February. We were kind of tossing up whether we should do it now or wait for Susan to come on board, but we think we'll have a pre-meeting. And then once she comes in, go over things with her also.
Gotcha. Thank you.
Sure.
Any other questions of David and the financial report? Thank you. Kent, do we make a motion and accept it, or? Yes, we do. Jim is saying yes. So I'll entertain a motion that we accept the financial report of December 2020.
So moved.
Yeah, that's Marty in a second.
Second. Sharon
Second.
Tucker.
Okay. Any discussion? All in favor signify by aye.
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 By nay. Thank you. Let's move then to resolution 2021-1 to carry forward certain encumbrances to this year, 2021.
Yeah. Thanks, Ben. Me again. Sorry. But no, this is the last of the end of year resolutions that come before you each year. Again, just as a quick reminder, what we're allowed to spend in any given year is the budget approved by the Department of Local Government Finance for the year you're in, plus any encumbrance dollars that are officially carried over by you through resolution into the following year. And these are contracts and purchase orders that existed at 12/31 that we haven't gotten billing for. So these are all items that we have a commitment, and we anticipate the invoicing and billing to come in, no later than, say, May of this year. In the cover memo, I kind of noted in there, a lot of them are library material purchases, $270,000 worth. HVAC projects like 227, some network projects, as well as some of the personal services actually for the director's search and stuff. So again, this is a standard resolution that we need to do so that we can pay for 2020 commitments with 2020 dollars.
So moved. Can we put this in the form of a motion in a second and then we could discuss?
I make a motion that we accept the resolution 2021-1 information.
And a second, please.
I'll second.
Ken seconded. Discussion. Seeing, hearing none. All those in favor signify by aye.
Aye.
And opposed by nay.
Ben, only one question we should ask. Do we need to do this by roll call, does anybody think, or not?
I mean, if it's unanimous, I will note it on the resolution.
Okay, fair enough. I just saw that it had individual signatures, so I just wanted to make sure.
Right.
Good
But-
point.
Yeah, what they're allowing us to do in this situation is because it's an electronic meeting, I just have to mark on the line the participants of it and then note that it was done via electronic vote.
Okay.
Okay, well, David, you're still up.
Yeah, exactly. In your approval of claims, I think Jill had mailed and emailed out to you the claims for today. And again, like last month, we are combining what's usually the ones that are done around the 10th of the month with one large register here. So as you can see, it's a pretty substantial amount. It does include the end of the year claims from 12/31. Anything really that was after the December board meeting. And then it also has the bond payment of $3 million up on top. And behind it are your high dollar claims. There is typical, a lot of library materials, utilities, the snow removals and things like that. So, but that's the total of the $6,647,000 on this claim register.
Okay, motion to approve.
So moved.
Second.
Paul and second by Marty. Any discussion? If not, all those in favor signify by aye.
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 Opposed by nay. That too passes unanimously.
Thank you.
Okay, we're now down to item 7 on our agenda, and that's the adoption of the statement on race and social equity that was originated from the Urban Libraries Council, their statement on race and social equity. Denise, would you take us through this?
Sure. So back in the fall, staff had expressed interest in moving ahead with this. And because there was a great deal of work that we have to do organizationally, I'd asked the board to give us some time to actually take staff through an activity that helped them think about the statement and how they were applying it now, how they would apply it in the future, and what are some of the challenges that they need to address. So they were able to complete that in December. And in January, the management team reviewed the synthesis of that work and confirmed that, yes, they wanted the board to move ahead with endorsing this statement. The work that needs to happen on all the action items and ideas that came out of that is sort of the long tail of this, and that will continue once Susan's on board. So staff have done that piece. One thing that's sort of supplemental to this that I wanted to point out to you, the library has joined the United Front work in Fort Wayne, and we have about 10 staff. This was in our Friday note to you last week. So that's also part of this. So we're starting to assemble the other activities that align with this statement. So the request is that the board endorse the library joining on with this statement.
Will someone place that in the form of a motion in the second and we can discuss?
So moved.
Second.
Karen, second, Gloria. Any discussion?
Yeah, I don't have in my packet, and I've looked through it twice now. It says that that there would be the statement would be included, but all I have is this.
It's on
Back.
the
It's on the
back.
back side of the page.
Oh,
It
that's
should be on page 58.
that's the entire statement there?
That's it. Yep.
Okay, so you had referenced, let me rephrase that, I guess. You had, Denise, referenced that there are some work items that need to occur as a part of this. Is there a list of that as well, or I just misunderstand?
No, there is no list of that yet because we're still working through that with staff.
Okay, gotcha.
Yeah.
Thank you.
You're welcome.
And to clarify that, the goal is to approve this policy that then allows you to work forward in those work groups to get all of that implemented.
Correct.
Is that correct? Okay, good.
Any additional comments or discussion? If not, then all those in favor, please signify by aye.
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 Opposed by nay. It is unanimously done. Those that did tune in yesterday to the United Front, we have amongst our board a star performer. Sharon, if you didn't see Sharon speak, I'm sure she can do private performances. Thank you, Sharon.
Trust me, I'll bend your ear about inclusion and equality.
At no cost to us.
At no cost.
Thank you.
Donation to the foundation, right?
All right, let's move along then. That's a good move on our part, but let's move along and speak to item 8 on the agenda. The approval of an installation of the City of Fort Wayne's electric car charging station in the main library surface lot. Denise?
I'll introduce this, but I'll hand questions off to Dave because he has more information about, the installation part of it. So the city had approached us a while ago, the library, to see if we would be a partner with them in a government grant to bring electric car charging stations to the city of Fort Wayne. And we agreed to that in principle and said it required the approval of the board. So once we learned that they had in fact received the grant, there was positive, they then worked with Dave and our facility staff to determine the lot that made the most sense. And the lot that makes the most sense for them is the Webster Street lot. So you have materials that Dave has provided that give you detail of what they look like and how much space they're going to take up, and probably more information than you wanted about the car charging stations. But ultimately at this point, because we had said it required the board approval, once they determined that they had in fact received the funding or were eligible for the funding, that we're bringing that now to you to approve that moving forward.
So whatever she just said was fine. No, no, really, yeah, that was a great synopsis to these things. And as she said, this came out of a settlement with Volkswagen on the emissions situation, and they put up a number of dollars for grants for communities. The city of Fort Wayne applied and received that, and their objective is to install around 27 of these charging stations around the area and help a green initiative to have more electronic vehicles. So they did a survey of a number of areas. The downtown area, of course, they're very interested in. And our lot is at Webster there, the one, behind or above King Euros and Rallies is what was done, because the power coming off, again, this will be totally funded by the city, not only the installation, but the ongoing costs and all. And so because the power lines run behind there, that lot was deemed to be, preferred because they can drop the power line right off of the lines that go along the alley in, down to the charging stations. It won't be on our circuits or anything, so we won't be paying for any of the ongoing electric costs on it. From a installation, they felt it was pretty, nice, a good location. As the picture shows there, what it involved will be 4 spaces. The charger will have the ability to go in the middle of the space or at the end in the middle and charge 2 cars at once. And then so they want to put 2 of those stations, 4 cars possible. It would be along that, south border of the Webster lot, the one edging up to the alley. And, there's still some things in play as we made note to them. This is a pay lot. It's a library lot. And so that, granted, if they were library patrons, they could come in and use their card to exit and enter and stuff. But if not, they might have to, understand that there could be a charge for coming in there. They felt that they could work through that would be no problem. We did inform them, they felt it was going to be okay. So we just really want to, go ahead and get your approval if you feel this is a good use of the spaces, and, allow them to move forward. Their objective is to have all of these installed by the end of 2022, and they're going to be starting this spring. So, not much more I can tell you, but I'm glad to answer questions.
Dave, I did have a couple questions.
Sure.
I am all in favor of this, but I do want to, one is the cost for the user, the city's applying electricity. Is there any cost at all? Somebody pulls in, they're not charging anything to the user?
I don't know for sure, Marty, but I don't think so.
Okay.
Most of the charging stations I've seen have been no charge, but
Yeah, I think you're right. I'm just kind of
Yeah.
curious on that. So, and I don't know what it costs.
yeah, I mean, I know there's some over at Parkview and stuff. I see them there all the time. I don't see somebody pulling in with a credit card and swiping or something there. So I don't think at this point they're charging for it. Who knows what they'll be in the future.
As far as we know, these are universal. So every Tesla, every EV, everybody can pull in here and charge at some rate or another.
Yeah, that's what that material, and back to one, they feel that is the, more universal one. I think probably the industry has some standards that they're trying to put on all the electronic cars and all, but, that's, you've reached the peak of my engineering knowledge. So that's about it.
All right. Well, here's the next question then. This is the lawyer in me coming out. Is there insurance on these things? If it blows up and blows somebody up, or do we have insurance? Are they providing that, or do we have indemnification?
That has to be all on them. In fact, we had discussions even of the patrolling, like, okay, what's going to happen if a non-electronic vehicle is parking in this spot? And we made it clear that, our security department, that is not their job to go out and ticket cars and tow cars and things like that. That has to fall on there. It would probably be something that if it was a problem, maybe their parking control department would do, but it won't fall on us, and they will have to have adequate insurance, on those.
Okay.
Unless we charge the internal combustion engine. Wait till the driver gets.
Yeah. Oh God, don't even go there. Somebody plugging that in to the gas tank. We laugh, but somewhere they'll
do that.
I
store
hope
it.
it doesn't fit. That's all.
Yeah.
Any further discussion, folks? Pretty exciting.
Yeah.
Okay, I'll entertain a motion that we approve the aforementioned discussion item.
So moved.
Second.
Marty, Kent, any further discussion? Not
Yes,
all
thank
those
you.
in favor?
I was just going to say thank you, Dave, for the thoroughness of what you put in the packet, because it really did answer all the questions I had on that end. I did appreciate the discussion though, but the board packet continues to be very helpful with situations like this. So thank you.
Sure. No, my pleasure. And I will certainly keep you posted and abreast of any of the developments as they occur.
Okay, all those, any other questions or discussion? All those in favor signified by aye,
Aye.
Bye.
opposed by nay. And let the minutes reflect it was unanimously done. At the last board meeting, I had made note of the fact that I, as your representative to the Library Foundation Board, have a conflict, and so I'm not able to attend all the meetings, which is not fair to the Foundation Board or me as your representative. So I asked board members to give thought as to whether or not they would want to serve. I have received one name. Is anyone else interested? The name, Kent Castleman has graciously volunteered to serve as a representative. Hearing and seeing no one else's hand go up, I'd entertain a motion that he be appointed as our representative to the Library Foundation Board.
So moved.
Second.
Second, Gloria, any discussion? All in favor signified by aye.
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 Bye.
Opposed by nay? Well, welcome aboard. You'll get the secret handshake Wednesday.
Thank you all for trusting me.
Yes.
Okay, let's move on to item 10. This was also in your packet, and this is a discussion of the emergency FMLA policy and paid sick leave policy. Kendra or Denise, Kendra?
Sure. As a recap, our emergency family medical leave and paid sick leave policy expires today, as it was set in place back in May. And so we need to decide what we want to do going forward. Does it end? I've talked through several different options to not have it completely end. I've shared with you what the county and city are doing, which they are changing theirs. They're extending it, but there's some exceptions, and shared some stats. And so we're coming to you to see what your thoughts are on that policy.
We had this in our packet and had ample time, hopefully, to review and discuss it, but this is a rather complicated matrix here. Does anyone have any questions of Kendra?
Kendra, this is Marty. I do have just a couple questions, not so much on what we reviewed, but I want to make sure that the staff, are they aware that it expired today? Is that something that's been communicated to them over time so that they are aware of that right now and that the board is making this decision today?
So they were made aware after the last board meeting when you approved this through today. So they were shared that information along with the policy. So they do know that. I'm not sure how aware they are that we're actually talking about this today and it might change. But there was a date put out there for them.
Since we have some visitors on our YouTube broadcast, perhaps you could just give a high-level overview of the comparison
Sure.
of ours versus the as-is coverage for city and county, anything that could help amplify and frame the issue.
Sure. So currently, there's several reasons why you might need to be off due to COVID. If it's related to you as the employee, you would receive 10 days of pay. And then if you're off, if you continue to be off, it goes to 75%. There's also coverage if you need to stay home with your child due to a school closing, and that coverage is at 75%. This was a federal thing that we approved, and it actually ended the end of 2020. It was not extended, but some organizations are extending or doing some version of the policy since we're still in the pandemic. So we had options of keeping it as is and establishing a date to review again based on the current conditions. We could keep it as is for employee only. So if they need to be off due to COVID, they would continue to have the 10 days that rolled over from 2020, not additional 10 days. And then it goes to 75%. There would be no coverage if you're taking care of an individual due to COVID, as well as no coverage if you're home due to your school closing. The county and city made changes, and both of them are pretty much the same. And so that's also an option for us. And what that would do, it would give you the 10 days for your own reason for being off due to COVID. And then there would be no 75%. So you get the 10 days, then it would go into FMLA. You need to use vacation, sick, to have any kind of source of income. Or we could end it just like the federal guidance is. If you're off due to COVID, going forward, you would apply for FMLA. You would need to use your vacation, your sick time, your personal time. If you continue to be off and you run out of that time, with their short-term disability, that pays at 70%. That's for full-time staff, not part-time staff. So those were kind of the four options that were put forward for your consideration.
And what has been our experience?
Yes. So we have paid out a total of 11,650 hours due to this policy. That equals $197,000. We've had 173 staff members utilize some form of this policy. We have 385 staff members, to give you an idea how that plays out. And we have 62 staff members who have used the 10 days at 100%. We've had, 20 positive staff members, and then many situations that were not positive, but the staff member had to stay out due to COVID.
Okay. Questions, folks?
Kendra, I know that one of the struggles we had, and that's why we're reviewing this right now a little bit, is we're continuing to see some of this impacting our ability to keep certain branches open, things along those lines from a staffing perspective. I guess I want to just clarify that's still a concern, and this is a barrier sometimes on, I guess, and I want to say that, I'm glad that we as a library have been able to be as generous as we've been able to be for as long as we've been able to be. But I think our role as a board is to ensure that our services, programs, and everything can continue for the public as much as possible. So, I mean, my concern whenever I raised, revisiting this conversation for the board is based around that. I think that that's one of the things that we have to look at is ensuring services are continuing in a way. So has this created a barrier sometimes for the staffing to run appropriately for all branches to be open?
If you mean having this policy in place, I don't think so, because regardless, if we follow CDC and Department of Health guidelines for those instances, we can't have staff at work. So they're going to be home quarantining for 10 days typically. So I don't think this is a barrier for that, but it does provide some reassurance and some income for those staff members who do have to stay home.
The you have the total situations at 218. Are those, when you say situation, I assume that's any COVID related concern that goes through human resources. Are those unique, or could one employee create a dozen situations?
Yeah, one employee could create 3 to 4 other situations. And we typically would, have that out. We would count that as 4 instances. But we haven't really seen, 12 people or so. It's usually 3 or 4 people. It's a branch. There was close contact, so they all need to go home. So they're all affected in some way. And then we have a lot of people who, were exposed to a family member or somewhere else where they have to stay home. So that would be an individual instance. So we have both.
So basically more than half of our total workforce have had a situation.
Correct. Correct.
That's a lot.
Yeah.
Well, I would support aligning with and being consistent with what our peer governmental entities are doing, which could be the city and the county in this case. So that's what I would prefer. But
Would you put that in the form of a motion, Paul, or?
sure. Do I need to pick the city or the county, or are they similar enough that I can just say both?
You could just say
Can I
both.
ask a question before you move your motion, Paul?
Sure.
The city, Paul, is doing the utilization of the balance of, right? So if an individual has used 15 of their days, then they get to use the balance of and no additional. And it's at your own expense. for lack of better words, once you're done with that plan. And I just want to make sure, I just want to make sure that that's, if we say we're going to move it to what the city has, that we're moving it with the full plan, or are we doing 75%? Or I just want to have clarity of what we're going to move forward, if that's what you're looking at presenting. So maybe when you present that, will you give me clarity on that? Because I want to make sure from, I'm confused a little bit on some of the comments. I didn't realize it was half of our staff had it and that we closed down. I thought a lot of the people were coming in without having contact from employees that were getting sick from outside sources, or.
Yeah, so I would say the majority are from outside sources. There have been close contact at work, and so it's affected many people, or a few people. When we've closed departments or branches, it could be that, but more than likely, we say that we'll close the branch and that we will clean after 24 hours. So it affects everybody at that branch who needs to go home, not because they were close contact, but because they were at the branch with that person during that time.
So I'm glad you can decipher my thoughts without a secret decoder ring, because I had like 500 thoughts come out in one sentence at that time. So thank you for being able to decode that. Paul, I'll let you make your motion, because I think I'm going to support what you're putting forward there.
Okay. Well, I would move that we utilize the same policy that the county and the city have implemented for their employees. Hopefully that's worded appropriately.
I'll second that.
Okay, we have a motion and a second. Any further discussion? If not, all those in favor signify by aye.
Aye.
Opposed by nay. It passes. Anybody abstain? It passes then unanimously. Thank you, Kendra, for the excellent work that you've done putting this together. Takes a complex subject and makes it a bit clearer.
Thanks.
Okay, that then deals with item 10 on our agenda. Let's move now to item 11, and this is the approval of the extension of limited service levels. And Denise, you're up.
Okay, so I sent to you all yesterday, after senior staff had some time to understand what was happening with the governor's extension of the executive order for masks and so on, and the code levels, and also what was happening in the county. So Allen County, so our original plan back in November was that if the county could stay out of red for 2 consecutive months and the positivity rates didn't look like they were trending up, then we would move service back to fuller service, not just by appointment service and curbside. In January, we weren't that lucky early in the month because we had to stay in sort of a code red status for a few weeks. The county has been in code orange for 2 weeks. The county Department of Health has moved us into code orange. So the county is in that level. And what we'd like to do is a bit of a hybrid. So what we had presented to you back in November was sort of a de facto, if we're here, we change services this way. And if we're red, we align in this column. And there's a little nuance here that I'd like the board to consider. And it's largely based around what we were just talking about, and that's staff availability to be in a building. So the mask requirement, social distancing, hand sanitizing, all of that is still in place, even though we're in code orange. We modified our hours slightly during code red, our open hours, and we'd like to keep those. What that gives us is a cushion in the morning and a cushion at night to get work done before the public is in the building. And we still need that because we have fewer staff trying to get the same level of tasks done. So we would like to maintain that. The other area where we want to stay in the sort of code red is curbside delivery. We actually expanded curbside delivery hours during code red because there was no browsing. We would like to maintain those higher level of hours available. And we'd like to do that for several weeks just to understand. So back in the summer, when we reopened to the public, our curbside use sort of trickled like this, and then it plummeted after folks realized they could get in the building, it was safe, and they adjusted to that. We expect that same leveling, but because of the weather, we're not sure if it'll be a drop like this or if it'll be more even. So we want to provide as much curbside service as we can during the winter. So we'd like to keep those hours at the code red level. By reservation, we'd like to keep PC reservation at 1 2-hour session per day across the system. And that's to support folks who are trying to schedule a vaccine visit, getting their visits in for vaccines and so on. Plus the scheduling of the 2-hour sessions has really worked with the public. They're using the computers the full time. So it's clear that they need it. And it makes it easier for them, makes it easier for staff. The other area, and this is a staffing issue, is the main underground parking lot. If we don't have 3 security guards in the building, we don't have enough staff to do all the patrolling outside the building that we need. So that we need to keep in place in case we have a staffing issue on a security staff. Everything else shifts to code orange. So that means holds go back to 10 holds. The ebook circ goes back to 10. Everything else just shifts back to our regular services. So browsing with, you can just come in the building and browse, borrow, all of that will resume. And we'd like to do this on Monday. It'll give staff a little bit of time to regroup and be ready to open to the public on Monday, February 1st. So questions about this? And the reason we need your approval is we're changing the holds rate, and that's in a policy. So I need a vote on this.
I have a couple of questions, Denise. I'm sorry, Ben. Were you
No,
gonna-
go ahead, dear. Go ahead.
Yeah. And as thank you. You've cleared up a few of the questions that I had when I was looking at the policy, but I guess my original thoughts were I was puzzled what an hour or a 2-hour would do with changing of the times to keeping them in the code red times as opposed to moving them to the code orange time. I understand you're saying now would give staff time to do things that they are unable to do. But either you or Kendra can address this one. At the current time or even next week, how many people do we have out that's impacting us to be able to go to full services for orange?
So I had indicated in the earlier conversation that just to kind of guess going through, I would say we might have 10 people out due to something COVID related. So that's current, and that kind of changes daily based upon return to work dates.
So, okay, and I respect that. And you did say that earlier. And that made me think, so for the 10 that we have, and of course the unknown number, there's no meat in my mind that says like, we're used to that number being out, whether it's vacations, whether it's sick leave, whether it's some other course. Do we have 10 for COVID and then a large number for, where is the gap appearing that we're unable to provide the services to our patrons?
So for instance, this week, we needed to close Waynedale for half a day because we didn't have enough staff to do the shifts in the afternoon. So we have a lot of part-time staff who work shift work. So if they're not able to come in and we don't have the right composition, we can't provide curbside and manage PC reservation and do all the other tasks. So the building closes. That happened earlier this week, and likely tomorrow we're gonna have another branch closed for a full day because we don't have enough staff.
So, and again, Denise, you guys have been running it fabulous. I'm not challenging that. I'm just asking for clarity. If we know ahead of time, like you're kind of thinking that tomorrow there might be an opportunity, there will be an opportunity, then we don't have the means to transition staff from another location to help assist?
We do, but we don't want to spread the virus, right? So it's that concept of pods. So we're reluctant to move staff around because if somebody finds out 2 days after they were, like I go to a Boyd And 2 days after I was at a Boyd, I find out I was exposed. I've now created a situation in the department I came from, plus the branch I went to. Both of those have to go into some sort of cleaning because I was there and I brought the germs. And this is the CDC. This is what makes this so complicated, quite frankly. So
who decided that piece of it, that you can't move people around? That seems, if we're practicing masking, social distancing, hand washing and all that, where's the thinking that, oh, I can't go to another branch to work coming from? Where's that fear emanating from?
Kim Boland, did you want to comment?
We don't prohibit people from moving. We do have some staff that will go from branch to branch if we have the staff available. Like for instance, Denise just mentioned New Haven. So I've been working with their staff for 2 days trying to figure out how to cover that branch for a full day, because we have to have a minimum of 2 people in the building, correct? Right? So I put a call out to all the other locations and nobody had any spare staff. Plus we have 4 floaters. And we have to remember, in addition to COVID, we have other illnesses that people are out for. We have vacations, we have personal time. So, and just general, emergencies, which we have with a floater right now. So we're short a floater. So we do everything possible to move people around within their comfort level, where we have availability to use the floaters, before we go the last ditch effort to close a branch down.
Well,
If I understand,
go ahead.
okay. I know initially I understood it to be that also that you try to stay with your cohort group as much as possible so that you don't move from place to place.
Right.
Now, of course, that could have changed too, but I know that we try to maintain that too. Not only with our students, but our staff and.
But everybody's moving place to place outside of work. Not everybody.
Oh, not everybody.
Many people are, and hopefully that will progress.
Yes.
And I hate to sound like the Grinch or whatever, but the policy that we just approved, I think, is a little more stringent than what we had previously. So that may impact your staffing, but it is human nature, it's simple human nature, that if it's easy, there's an easy way out, so to speak, people are going to take advantage of it. And I'm not suggesting that everybody's taking advantage of it, but the easier you make it, the easier it is to take advantage. And I personally feel like I have a pretty significant responsibility to look out for the patrons. And the patrons want services, especially during these really tough times. People are being driven literally crazy with all of this. And so I hope that we all just keep that in mind. I understand you want to have staff be comfortable with everything, but there comes a time, when you have to direct folks to do their work.
That's what
a lot of people out there doing it. And I'm not suggesting you're not. I'm just kind of making my voice heard here.
Yeah, no, and I agree with you. And that's what we do. We go to all the branches. I have Nate Bernard. Sometimes he's the main manager. Sometimes he'll fill in a branch for me just so we can keep it open. So, we're doing everything we can to work together as a team to keep our branches open, and not, as Denise said, also be careful that we're not exposing people at multiple branches if someone happens to have COVID-like symptoms, so we're not having to shut down multiple locations instead of just one.
Well, and I don't want to get into this detail, but are we hiring more? Can we hire more part-time people to, again, try to focus on providing the services that we need to provide?
And that's a whole nother discussion.
Yes.
Well, I mean, from that standpoint, I agree with Paul on this. I feel like if we need to add 5 more bodies or something to be able to make sure we can help with this, I think that's important. I think the thing I'm struggling with on this whole thing is it feels like because we have certain instances where a branch might be affected, the entire system is being impacted by this policy. And I look at it and go, most businesses and most organizations right now we understand that sometimes those branches might have to close. I just went today to buy a camera, and I went down here to our Office Depot on Lima Road, and it said, this branch is temporarily closed. I assume it's probably because they had an exposure and they had to close the store for, a few days for cleaning. I guess I don't understand. I mean, I understand that we have to do that along the way, but what I don't understand is why we still need a policy in place that is restricting services for another month. I feel like, can't we flex and close those branches and close those, that need to be cleaned, but allow the rest of the system to return back to the pre-service or, pre-COVID level services, or our service prior to this red zone.
So what pieces that are the code red side is it just the hours open?
Well, the limited browsing.
It's not limited. On Monday, anybody can come in the building.
Mhm.
Yeah,
Okay.
that goes away.
Okay, I've misunderstood then.
No, and curbside hours are increased in code red. The
Okay.
only thing that's reduced is the open hours by 1 hour in the morning.
And 2 in the evening, right?
So everything's returning back to the pre-red zone
Right.
reductions.
Right. It's only a few of the items that are staffing related.
Is it 1 in the morning and 2 in the evenings, or 1 in the evening?
One on either end.
1 on both ends.
And is it just Maine that's affected by the 1 hour in the morning? Is that correct? Because the branch is open at 10 a.m. anyways.
That's correct. It's just
So
Maine.
only Maine has that 1 less hour in the morning.
I thought I read that the branches would close at 6 as opposed to the 8 o'clock hour that they have. I could be wrong, but I thought when I looked at the report that that's what it was saying. Y'all think y'all figured I read this stuff, didn't y'all? I tricked y'all.
Right, but for the 1 hour in the morning, it's only Maine that's affected by that 1 less hour in the morning.
But your question, yes, correct.
Talking about the larger branches versus the smaller branches that aren't as busy. Yeah, so the larger branches close at 8, so I will clarify. And then the smaller branches, which have the smaller amount of staff where it's harder to keep them open, they do close at 6. You are correct.
Any further, Kendra, did you have your hand up?
I just want to make a comment that unless you're really in the situation, it's hard for us to make some decisions too. And we have to rely on the personnel, staff, and I believe that they do an excellent job, because eyes looking in and thinking in terms of other things, it gets really tricky. And I just have to applaud what they have done. And I applaud all of you as board members for asking the questions too. But it is hard. And it's hard for all of us in the community to have to give up some things. So I'm hoping we can stay in orange and continue with what Denise and her staff have put together. And that way eventually we can get back to being totally open. But it is hard for us to sit here and make a judgment sometimes based on, because we're not in the institution and trying to make it work. Maybe because I'm in an institution and know the pros and the cons and trying to make people happy. And we all want our libraries open. So thank you for where we've gotten for right now.
So may I have a motion to extend the limited service levels due to COVID, and a second, and we can then discuss further?
This is Mark, so moved.
Can I have a second?
Second.
Second.
Okay, that's second. Further discussion?
And this one's hard for me because it really is a balance between what we can do and what we can't do. I guess I wish, if I kind of agree with Ken, if that branch is impacted, let's close down that branch for the amount of time that we need to, as opposed to the whole system. But I'll spend a little bit more time and listen to what other people have to contribute, but I'm still on the fence with it.
But my understanding is that the site specific. If one branch closes, we don't close all the other branches.
No, correct. Correct. We do not.
It's
No.
situation specific.
That's correct. And it could be a department or it could be a branch,
Yeah, right.
single location.
Your
Yeah,
code,
I'm sorry, I
your
think I
code
would-
red orange report is asking for the hours to be modified for the, across the system, right?
That is
Or am
correct.
I, that's basically what we're voting on, right? That's what I'm saying I'm on the fence about, the hours across the system being reduced. And so although I understand and respect what Gloria is saying, I'm having a hard time dealing with it. So I'm trying to get that balance for me.
Yeah, I agree. This is it's a staffing issue as much as a COVID issue in some respects. I'm not sure what the proper approach is, but I have to lean against this just because I believe that we're tying our hands in terms of, really making just as many services available as possible.
I guess this is Marty. Obviously, I made the motion, so I support what they're doing, but I think we have to recognize it extends for another month. I think Denise and Kim can take into consideration what points you're raising and think about that as we go through it and see from hiring more people to, hey, maybe we should just try to keep the other branches open, the extended hours to help the community. But I do think we should move forward with this and do what the staff is, what they've asked for the month, and then revisit this next month.
Further discussion. So we have before us the recommendation by Denise to extend limited service levels. And this will be evaluated next month at the same time based on experience that we've gone through.
Correct.
Okay, all those in favor signify by aye.
Aye.
Opposed by nay.
Hey,
Let the record show Paul registered a no vote. Any abstentions? Okay. 6-1. Okay. The next item, committee report, capital projects, an update on the facilities master plan. And before we get into that, at the last meeting, and I think at a prior meeting than that, we talked about the appointment of Library Building Corporation Board as a result of the passing of Betty Stein. Currently, we have Mike Horton, Alan Grinsfelder, Janice Code, and Rich Beck. And we need to have a fifth appointment. Has anyone given any consideration as to, because I don't think there are qualifications other than willingness to serve. And as we get into the capital project scene, this is an important role. Has anyone given any thought to any suggestions or nominations?
I have been, but I'm not sure exactly how often do they meet and what do they really do?
Well, since Marty chairs the capital project, maybe he could help us.
Do you think so?
Ben,
I think we'll ask Dave that question, actually.
Well, actually, I'll divert to Pete. Yeah, Pete and I, do a lot of work with the building corporation. Pete can tell more, succinctly about it.
as it stands right now, and Gloria, you've asked the question,
Mhm.
we're getting ready to schedule the annual meeting of the
Okay.
directors. There isn't an exact time frame, but the spring into early summer is about the time we typically meet. And it will kick into gear with something more specific if there is a capital project that's going to require bond financing.
Okay.
And that's when the building corporation really comes into play. But we've kept it going, and there's no reason to disband it because we are anticipating another project. So whether or not there is bond financing. So I think that's the main role.
Okay, I think just like in a school corporation, we have that
Yeah.
helps me.
Yeah,
Exactly.
if there's bond financing, the building corporation will take on ownership of the property.
Okay, I understand.
Have we, are ever had a board member on it? Or has it typically been outside, people from outside of the actual board?
Um,
Not since I've been on board.
Yeah, to my knowledge, we've never had a board member on it.
Okay, I was just curious. I didn't think we had, not to my knowledge we ever have either, but
There's nothing that prohibits that, correct?
No, it doesn't prohibit it.
Yeah, I was wondering about that as well. Would it be beneficial to have a board member on there or not?
Not particularly.
What do you think? Board
fair
member.
enough.
Maybe a better way to ask it is there any issues with a board member being on it? If there aren't,
I don't think so, but I would say that it probably also isn't a bad idea to have the separation of responsibility.
Mhm, mhm. Yeah, I would agree with you on that.
Okay.
Well, the annual meeting has yet to be scheduled.
That's correct. It's
And
not been scheduled.
there is no rush to have that yet. Why don't we give another month and have the board, now that we know the qualifications, meaning no board member should serve on it, we can come back with names for the next board meeting.
Okay.
Okay?
Yeah, let's make it definitive. Anybody has somebody in mind, let's get it to Ben in 2 weeks or so. So let's
That's a good point.
get this done. If he doesn't get one, then he knows.
yeah, we've been kicking this around for probably 6 months to 9 months. So
Yeah.
Yeah, we need to decide.
6 to 9 months, I would say.
sorry. Yep.
Okay, well, that's it. All right, capital projects update. Kim?
Yeah, I'll get started and Kim can fill in the details because she and I have had our conversation. First, I'm on the chair on the Capital Projects Committee. Kim actually was nice enough to give me a tour back, I think, January 12th of the property to kind of really walk through the library again. Because it's been a while since I've been in there. Kind of see the ongoing project with Roland Center, and then also kind of talk about through the ideas that we're having for moving things and making some adjustments to the library space itself. So just as a reminder, our facilities master plan servicing RFP schedule, we are right on schedule right now. We had 16 architects and planning people come forward with, or proposers, I guess I should say, to responded timely. Since then, we had a deadline yesterday of actual proposals coming in, and we had 11 come in. We only lost actually one of the people who had registered initially. The other ones combined in various ways. So we have 11 different proposals that came in, kind of a mix of local and national. And Kim can talk about that in a little more detail. But the target right now is the review team, which is senior staff, and then I'm a part of that. We'll review those and try to narrow it down to 4, maybe 5 if we have to schedule a time to meet with them. And then try to schedule interviews, probably by Zoom, but we all have to decide that yet, the week of February 15th. Right now, we're thinking Tuesday the 16th and Wednesday the 17th to try to schedule times to meet with and discuss. So have those interviews and then come up with a decision, or at least our recommendation. And then we would have our contract to the board meeting on March 25. Anyway, that's where we are right now. Any questions? I'll try to answer them, but Kim probably is the best choice to answer them as well. So I'm going to get everything electronically, all the proposals, and then I'm also going to get them in paper. And then Ben and Kent are still on the Capital Projects Committee. Ben, I assume you still want to be, right? Even though you're president now.
I wouldn't miss it for the world.
But in any event, I think Kim will share those electronically with Ben and Kent, so you guys can get to me your questions. So then I'll be part of the interview process, and then or maybe even your thoughts and narrowing it down to 4 or 5. And then as we do that, then we can move forward. Anyway, so it seems to be moving forward on schedule right now.
Good. Any additional questions or comments? If not, let's turn to Denise and the interim director report.
Can we go back to the EFMLA discussion item? We need an end date. So do you want, maybe Kendra should speak to this. They had end dates on policies.
So the counties was June 30th, the cities was March 31st.
Well, we're following, according to the motion, we're following the county, aren't we?
Oh,
I don't think we officially clarified that, Ben. I think
No.
we said the city and the county. I would move, an addition to that would be to extend it through June
I would
2000.
agree with that. I think we should make some certainty and just do it through June. Hopefully we'll all be vaccinated by then. We'll figure things out. So,
yes.
So we need that modification in a vote.
Yeah, I would move that we make that the deadline for expiration be June 30th.
And the
Second.
second,
Second.
second.
Paul seconded. Any discussion? All in favor, aye.
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 Nay. Let the roll call show it was unanimous. Okay, you're up again.
Okay, thank you. So in the interest of time, you guys have had a long meeting so far. In your packet, you have the interim director update. You have the monthly outputs. There's an error in that, some math formula errors. So I'll get that corrected for you for next month. We didn't actually have 37,000 hoopla circulations. We had 992. As much as we would have liked to have had 37,000, we didn't have that high of a number. You have the monthly outputs, the collection management report for the year end, and you have the fourth quarter 2020 strategic plan update. Then you also have the manager's update report. So you had a lot of documents this month. It was an odd year, right? We did much better than I expected, given, the open, closed that happened. Staff just continue to excel at providing virtual service and, helping the community as much as they can. So I think, all in all, it's been a good year, despite the pandemic. I guess the only thing that might have been worse is the zombie apocalypse on top of it, but next year. Who knows? Not to.
Don't breathe that into existence, Denise.
Training for staff is up astronomically. Just the amount of effort that staff have put in and professional development has just been stellar this year. So, we're working with, a year that was just peculiar. So we can't set benchmarks because, we didn't have full services. So just from an evaluation perspective, this is a bump for us, but that's okay. I'm happy to answer any questions that you have, and other senior staff as well, if they can step in and answer any questions.
Denise, I just want to make a comment. I don't think we can reiterate this enough that, we do appreciate the efforts that the staff are going through on all of this. During the meeting, we've had an email from a concerned staff person, and I feel like the concern in that is that we're not recognizing the level that staff are going to make sure patrons are served. And we are. I think it's always, I don't think everybody understands until you're in this role that it's hard, because our job is to make sure that we're also doing what we as a public institution need to do as far as programs and services go. And weighing that in this pandemic, it is something that I don't think everybody understands. There are individual conversations between board members that happen all the time that show the appreciation we have for staff and that. And I just want to stress, what we said earlier. If there are recommendations or any modifications that need to be done with additional staff or some things to support staff and make sure that we're serving at adequate levels, I think that, if anything needs changed, let us know on that. I feel like there's flex in the budget to probably be able to make that happen. But I just want to stress that piece of it. I still do, because I know there's concern out there, and we thank you very much for being frontline and serving our community every day. And we want to make sure that if there's anything that needs to be done there, that we continue to support the staff however we can.
Okay, thank you. Thank you. I appreciate that.
Yeah.
Well said. Any other comments or questions of Denise?
I would like to just kind of piggyback on what Kent is saying, and it's a hard balance between the emails that we get from the public, sometimes complaining about the lack of service, and between the care that we have for the staff, making sure that you guys get everything you need to. And I just think also that Denise and the whole executive team. You guys have been doing a phenomenal job. And so it's a lot. It's just a lot. It's a lot. Thank you.
Thank you.
Okay, hearing and seeing none, let's move on. Just out of curiosity, Susan visited our facility a couple Saturdays ago.
Yep, Sunday. Yep.
Sunday. And Denise and Stephanie accompanied her around, it's my understanding.
Yes.
Go ahead.
And Kurt helped as well. He pinch hitted a fine book room tour for us while she was there. But yes, she got the short visit, through Main Library, and got to meet with staff. So there were a few staff around that she got to meet with. So yeah.
Good.
Sure.
And it's my understanding she has found a place in which to reside. So pretty soon she'll call herself a Hoosier.
That's correct. That's correct.
Any new business to come before the body?
I have a quick question.
Yes.
Do you have any anticipation, Ben, as to how long we're going to continue with the virtual meetings? And the reason I bring it up is I think most people would acknowledge that having the meetings in this manner does limit folks' ability somewhat to see and hear and participate in these, because not everybody can do Zoom and all that. So I'm just curious. I mean, I'm attending meetings, at work frequently. I know other people do. And we had previously been pretty well socially distanced at the board meeting. So do you anticipate next month being back, if we choose individually to participate personally, or longer?
If you're asking for my personal opinion, I prefer caution. And I know we had a capital improvements board meeting virtually this morning. The governor has allowed those types of meetings, public meetings, to take place that way. But we also had the opportunity to have people present at the meeting. So I guess it's something to discuss with Denise and staff about the logistics, and we can get back with you.
So with what you just approved in sort of hybrid service levels, meeting rooms at Maine are bookable starting on Monday. So we could hold space for those who wish to attend in person. I will say you may recall that the hybrid version, where you have some coming in remotely and some in the room, sound quality continues to be a challenge, simply because the rooms that you meet in weren't designed for that sort of acoustics. We'll do the best we can in accommodating that. The meeting rooms, though, would limit the number of individuals that could participate in person, like sit in the room. So we had an overflow room when you were meeting in person here, and then they would come into the board room itself to ask the questions, and they could watch the meeting on a screen in the other room. So we do have just some space considerations given social distancing requirements, but we can certainly look into that and see how we can improve that for a February meeting if you wanted to do a hybrid.
Well, I'm not going to lose any sleep over it. And I don't want to infer that everybody on this is over 70 years old. That's for sure. I'm not. I know many of you aren't. But if you are, and we, as we progress month by month, hopefully folks will be getting vaccinated there that are on the board, and we'll be able to meet. So I'm just asking that we kind of set it as a goal to look at it prior to each meeting, say, hey, if we can get together, we get together. I just think it allows more people to not participate, but to view, I guess.
I would say, as the senior member of the board, I'm due for my first shot this Saturday at the Neuro Center.
There you go.
Based on that sequence, looks like the March meeting, I'll be fully ready to go, live and in color.
Well, it doesn't hurt a bit, I can tell you that, the shot.
Stephanie, did you want to say something?
Oh, just a reminder that aside from the streaming right now on YouTube, we do post a recording of each meeting to our Facebook page. We put it on the library's website, and also Access Fort Wayne airs it a couple different times. So there are multiple ways to view the meeting other than just this session.
And for those that aren't at the meeting at this point, they certainly can use the trustees' email address to address questions that they might have had, and we would respond accordingly too.
I understand that. I'm not going to lose sleep over it, but I think we should also try to set an example. We're asking staff to be there. So just an ask. Keep it in mind.
We will take all that in consideration and come back with a response. Anything else that could come before the body? If not, I'll entertain a motion that we adjourn.
So moved.
Second?
Have you taken public comment?
Yes. Public comment.
I'm checking right
And
now.
how do we do this?
Just remind everybody that they can send that to the trustees.
Yeah, I did that.
Yeah.
Okay.
Thanks for reminding me though, Pete. Okay. Any,
The only public comment was the item that Kent raised earlier.
oh, okay, I didn't see that.
It happened during the meeting.
Okay. All right. Well, thank you. All those in favor that we adjourn, please signify by aye.
Bye.
Opposed by nay, be well and stay safe.
Yes.
Bye, everyone.
Okay, bye-bye.
Bye-bye.